Hi, I'm Dr. Richard Bunio, Executive Medical Director at Cherokee Indian Hospital. Over the last several weeks, CIHA and EBCI Public Health and Human Services have been working hard to successfully roll out COVID-19 vaccinations to our community. Now that you've received your vaccination, we want to ensure that you understand the possible side effects that you may experience. The COVID-19 vaccine will help protect you from getting COVID-19, but you may experience side effects, which are normal signs that your body is building that protection. These side effects may feel like the flu, and may even affect your ability to perform your daily activities, but they should go away in a few days. Common side effects can include fever, fatigue, headache, chills, diarrhea, muscle and joint pain. There might also be pain, redness, or swelling on the arm where you received your shot.
Good morning, my name is Tammy Gibby, and I'm just letting you know the experience of my COVID vaccine. My experience having it was that I had like a low-grade fever, but I did well on both of my vaccines, and I've done it to protect me, and to protect my family, and also to protect others out in the community.
Here are some helpful tips if you are experiencing pain or discomfort. Consider taking an over-the-counter medicine such as ibuprofen or acetaminophen. To reduce pain and discomfort where you receive the shot, apply a clean, cool, wet washcloth over the area and use or exercise your arm. If you are experiencing a fever, drink plenty of fluids, and you may take over-the-counter ibuprofen or acetaminophen.
My name is Robert Martins. I've had both doses of the vaccine, and the only side effect I had after the second vaccine was a pretty bad headache for one day, but totally worth it and grateful to get the vaccine.
In most cases, discomfort from pain or fever is expected. Contact your doctor or healthcare provider if the redness or tenderness where you received the shot increases after 24 hours. If your side effects are worrying you or do not seem to be going away after a few days.
I was able to get both of my shots last month. I did not experience any kind of reaction. It wasn't especially unpleasant. It was like a normal shot, and the only way I could tell that I actually had a shot is if I rubbed my arm, I could feel I had a shot. I didn't get fever or pain or anything.
I didn't have any issues other than a sore arm both times, and that's after the second dose, it was even less sore than the first. So I would encourage everybody to jump right in there and get their vaccine.
Here are a few important things to remember. Side effects may feel like the flu, but they should go away in a few days. With most COVID-19 vaccinations, you will need 2 shots in order for them to work. Get the second shot, even if you have side effects after the first one, unless a vaccination provider or doctor tells you not to get the second shot. It takes time for your body to build protection after any vaccination. COVID-19 vaccines that require 2 shots will not achieve maximum protection until 2 weeks after the second shot.
I've had both. My first dosage wasn't too bad. I didn't have a fever. I just felt a little bit tired, so that's normal. My second dosage, I did develop a lump in the shot area where I received it. And I, didn't have any other symptoms besides that. It wasn't, concerning, but I was assured that the lump in my arm was okay, that is a normal reaction, that is my body just telling me like, hey, this is not supposed to be here. I'm going to protect you. So it's a good thing. And I also got my vaccine to help, keep my community safe, keep my family safe, and also myself.
On February the 18th, I received my second dose of the Moderna vaccine. With the first dose, I didn't feel anything, just a little sore. But the second dose, which I got on the 18th, it took me down for about 30 hours. I did run a temperature of about 101, aching and chilling. The biggest thing I was told is go home, rest, get plenty of rest, and it was tough, but I'm fully vaccinated now. And some healthcare professionals told me, listen, you know, you had a reaction, your body was fighting it, so that tells us you've got a good immune system.
Even though you have received your vaccine to protect this community, it is important for everyone to continue using all the tools available to help stop this pandemic. Please continue to cover your mouth and nose with a mask when around others. Stay at least 6 feet away from others. Avoid crowds and wash your hands often.